Hi, this is Alexis Bordelon, and this is Case Study 2. The client is a 4-year-old female named Olivia. She was diagnosed with autism at the age of 3. Olivia is a triplet and spent some time in the NICU as a newborn. There are no other pre-existing conditions to note. Olivia has been receiving in-clinic ABA services along with speech and occupational therapy for about a year and 6 months. Olivia began exhibiting problematic behavior exhibited as tantrums. Tantrums have been operationally defined as any instance in which Olivia engages in 2 or more of the following behaviors at the same time: crying, vocalizations louder than normal speaking voice or without tears, screaming, vocalizations louder than normal speaking voice, and or flopping, going limp, resulting in the body in a kneeling position or laying flat on the floor position. An example of this is if the client flops in the hallway while screaming when leaving the gym play area. A non-example of tantrum is if the client trips and falls in the hallway, resulting in crying. The behavior has recently increased in duration and frequency, resulting in barrier to treatment. As Olivia's tantrums increase in duration and frequency, the BCBA decided extinction was the best intervention to proceed with. Operant extinction is when a previously reinforced behavior is no longer receiving reinforcement. This will, in turn, decrease the occurrence of said problematic behavior. It was determined that the tantrums were being maintained by attention in the home and clinic setting. Therefore, by removing attention from the therapist in the clinic setting, you are removing reinforcement. When Olivia tantrums, therapists were instructed to ignore as long as the client was safe in the gym setting, and at ABA table to turn the client towards them and ignore until calm. Extinction intervention was determined by asking the parents and therapists a questionnaire surrounding Olivia's tantrums. Therapists also collected antecedent behavior and consequence data when the problematic behavior occurred. Through these 2 methods and direct observation of the client, the BCBA determined the challenging behavior function to be attention-seeking. Tantrums are being maintained by socially mediated attention. This is when reinforcement comes from another person. In the home, Olivia's tantrums were reinforced by gaining attention from the parents. In clinic, Olivia would gain attention from peers as well as therapists. Peers would look at her and often try to console her when crying, while therapists would prompt mandate and problem solve why the behavior occurred in the first place. Differential reinforcement and alternative behavior, DRA, is when desirable behaviors that you want to increase are reinforced and undesirable problem behaviors are not reinforced. DRA was used with Olivia when tantruming occurred. She did not receive reinforcement until compliant and a skill was completed. On the other hand, when she would appropriately ask for attention by calling people's name, tapping them, or using phrases such as "look," Olivia was reinforced with attention and verbal praise. These reinforcers were conditioned to Olivia. She was taught that using one of the alternative behaviors resulted in the same outcome, attention to her. Once this was established, we worked on the behaviors being generalized to peers and parents in other settings than ABA. Stimulus control. Stimulus control is when behavior occurs more often in the presence of an SD. The SD that Olivia's therapist would prompt was, "What do you want?" Olivia would then respond with one of the previously conditioned behaviors of calling someone's name, saying "look," or tapping someone's shoulder or arm. As time went on and antecedent strategies were implemented in the SD, "What do you want?" would be delivered before she engaged in challenging behaviors. The frequency and duration of tantrums decreased over time.